Faye, let's talk about healthcare a moment.
Yes.
In the LGBTQ community, one of the top issues that our community faces is, of course, healthcare.
Yes.
And there's a lot, and it's complicated. And we have a great opportunity today as we have invited Holy Cross Health.
Woo!
And Holy Cross Health is here, and that is Kim Saiswick, who is the Vice President of Community Health and Wellbeing, and
Yay,
our
Kim.
friend of the show, Von Biggs, who anchors at Queer News Tonight.
Yes, he
He
does.
is the Community Outreach Coordinator. Now, if you're not familiar with Holy Cross Health, it's a very interesting story. First off, it says Holy Cross.
Yeah, that part.
Right? That part. And many in LGBT might pause by its name.
I did initially.
And we were really excited last month where we announced exclusively on Queer News Tonight that Holy Cross made the designation from the HRC's Diversity Healthcare Index as one of the best LGBTQ healthcare systems in America.
Yes.
Holy
Yes.
Cross. Isn't that awesome?
Holy Cross.
Holy, yeah. That's a Batman reference.
I know, no, it really is. And nobody works harder than Kim and Vaughn. I mean, they are at every community outreach event. They are always on social media. People send them messages at all times of the night just saying, hey, I need to know where to go for good health care. And Vaughn will answer at 1 in the morning. That is the type of guy he is.
So we welcome both of you, and I have to be Andy Cohen for a moment as I look at the picture of both of you in your feathered headgear. And who wore it best? Oh, I'm sorry, Kim, you wore it best.
Vaughn.
I agree.
That's hard. That's a hard one.
It's
I'm
hard.
sorry.
It's hard. Well, welcome, Kim and Vaughn. Welcome to Stonewall Pride. Happy
Yes.
Pride. Vaughn's a member of the LGBTQ community, and Kim is a very happy advocate of our community, ally. Well, let's begin. You got the news that Holy Cross was designated by HRC as one of the best, most diverse LGBT-embracing healthcare systems in America. This takes months and months and months, reams of paper. Thousands of trees must be taken down to do this reporting application with the HRC, right? And you did all of that work for months, and then you get the news, and you open the letter, presumably, and it says, Holy Cross Health. Did you say holy?
We said, oh, we're top performers.
Right.
Right?
Yeah.
Yeah.
What
We were
was it
excited.
like, Vaughn, for you to be associated with Holy Cross and be a cog in the wheel, the big wheel, to help Holy Cross move to this moment?
Well, I think it's important to recognize a lot of people within the Holy Cross system, in a way, kind of felt like we were already doing the work, and they were. It was a matter of now just aligning, making sure policies and procedures were in place that allowed for protection, allowed for non-discrimination against anybody in the community. Holy Cross is there to treat the person, the dignity of the person as a whole. It's a human being. It's not a lesbian. It's not a queer man. It's
a human. Go figure,
Right.
right? Yeah.
Take down the barriers and take care of the health. And that's what I personally see and feel every day that Holy Cross offers to the community.
You know, for our community, a lot of people think it's about, you have to keep your mic up. A lot of people think it's about MPOX, or it's about HIV, or their mental health, various different kinds of things. But really, for LGBT healthcare, the biggest issue is access and the acceptability of not only the employees that work inside the healthcare system that are LGBT, but the LGBT. Kim, tell us a little bit about that, of how Holy Cross has helped bridge that gap of accessibility.
Well, access to healthcare has always been an issue in this community, and so we felt it was very important to put our healthcare into community. So if you go right over the tracks just east of here, we've got our primary care, Wilton Manors, and they service everyone, specializing in LGBTQ positive healthcare, but open to everybody. We have another clinic on Sistrunk, and that specializes servicing our Black community. So we are very passionate about making sure we meet the community needs, and that's really what we're here for. Doing this whole HRC, HEI index, it was really important. Like Vaughn said, we were already providing the care. We were already doing the right thing, so to speak. But we needed to be able to say, someone from the outside has looked at everything, has gone through the policies, has really taken a deep dive and said, you know what? They really are high performers and are doing what we need to be doing.
And you're doing God's work, baby. Not because you're called Holy Cross, but you really are, we all know the health disparities that our community deals with on an everyday basis, And like Al said, it's not just PrEP, it's just a checkup. It's just a yearly checkup to make sure that you're okay, And a lot of people in our community just want to be seen. And at Holy Cross, you see us.
Right, and we want to make sure people are treated safely, they're treated correctly, they're humans.
Yes.
And that has to happen, whether it's in the ER, the primary care, and you're right, a lot of LGBTQ health does not go treated until late, and it's unfortunate, but we're a safe place.
I want to take a moment to talk about the elephant in the room, about Holy Cross. And I made a joke at the beginning. It says Holy Cross. And it is part of a faith-based Trinity Healthcare, has hundreds, presumably, of hospitals all over the country. I hear that the faith-based hospital chain of Trinity Health has really started to focus on what Holy Cross has done so it can be replicated in other Trinity Health hospitals and systems around the country. Is that rumor true?
We sure hope so. We are the first. We are the first often, and that's okay. We like being first. We're up for the challenge, and we do the right thing. However, we also set precedent, and I think that's what you're alluding to, Al. And now that we've been able to do it, it says to our sister hospitals nationwide, if we can do it, so can you.
Yeah. And Vaughn, what do you think about the faith-based behind Holy Cross interacting with you're a gay man, right. LGBT. What do you think about the interaction between a faith-based health institution and our community?
Well, I look at it from my only background, which I have a lot of religious background in my life, growing up as a child and all of that. But I view it, as I said earlier, it's how you treat a human. It's about love more than anything else. And I feel like that gets edified and lifted up. It's not about the word as far as this is that, this, to follow this. At the end of the day, it's dignity. It's a way, to uplift one another and love one another, not tear down the walls that so many other entities continue to do. I mean, we've talked about that, some of the religious organizations out there that are just smear campaigns. And it's like, where's the love in that? Where is the... I hate to say it this way. What would Christ do, in my perspective? Yeah. That's not what he would be doing. Yeah. He would be where we are. Yeah. He would be in the community, which is where we're continually to embed ourselves into. We're not running from the community. We're coming here.
Yeah.
We're at the
running
Eagle.
To the community.
Right.
Actually, that's an interesting point. Let's talk about local for a moment. Faye, I'm getting ready to do you a solid here.
Uh-oh, here we go.
All right. Right here, right down this street, Holy Cross has a clinic. And please forgive me because I don't remember his name. The doctor that I've met many times.
Was he hot, Al?
Wait, I want to hear the name.
Was he tall?
He was very tall.
Okay, then I think you're talking about Dr. Jason Severs.
There it is. Faye, you must meet this doctor. It's like, you remember Shondaland's Dr. Dreamy?
Yes, of course, McDreamy.
Dr. Dreamy, and he's gay. So you can't touch him, but you can adore him.
Oh, that's no problem. I adore gay men all the time. Yes, that's what I want to do.
All right, so...
I'm going to go, yes.
I've helped you. Now you help me. Sometime this evening you keep searching. And so you have these local clinics, but then you have the big hospital that's only like 3 miles from here, Holy Cross Hospital. Tell us about that hospital in terms of its importance in our community. In Ground Zero, Oakland Park, Wilton Manors.
Absolutely. The hospital services all the specialty areas that everybody is going to eventually, unfortunately, need. If you look at chronic diseases, we've got all the specialists. We have a great cardiac line, ortho line, cancer line, all those things, neuro, and all those specialists who are going to send you for whatever it is that you might need can meet your needs. And when you come into the hospital itself, it's a safe place. When you go into the specialist office, they're safe places. On our website, we have a list of all the allied physicians We have other physicians who are also gay. We have one in our audience right now, Rob Joya. We have Mark
Hey,
Doyle.
Rob.
in our
Dr. Rob,
audience.
yes.
Mark Doyle is our CEO. He's right here supporting us today, supporting this.
The CEO of Holy Cross is here? Wave
Yes.
your hand. Good for you.
I love it, with a drink in his hand. He
Happy-
deserves it.
Right.
He deserves it.
That's all right. Happy Pride to you. One of the things that I want to say about Holy Cross, and one of the reasons we wanted to talk today about LGBT health at Stonewall Pride, is Vaughn is the easy seat. In all frankness, wait, I didn't say Vaughn is easy.
Right.
Oh, wait.
Let's get that straight.
Wait.
Wait a minute.
Vaughn is the easy seat to represent in community outreach to LGBT. You're the next tough seat, being an ally and being at the vice president level for a hospital healthcare system. That caught my attention. But what really caught my attention is early in the year when the board chairman of Holy Cross Health is the new board chairman and is gay, living in Wilton Manors.
Yep.
It was like, oh my gosh, there's something going on at Holy Cross.
Talk about representation.
Yes.
Tell us about, and make sure you say his name, the board chairman at Holy Cross.
Go ahead. You want to start?
You go first.
All right. Well, Rudy, Professor Rudy, he's amazing. He will tell you he's a recovering Catholic. Has been a
Right
board.
to your
He's
mouth.
been on our board for a number of years, and he was voted unanimously to represent as the board chair. And we are thrilled to death to have someone from community leading our hospital. It says a lot for Holy Cross. It says a lot for Broward County, and it will say a lot and does say a lot for Trinity Health.
Yeah, absolutely. Anything you want to add about it?
You know, it continues to show that we're breaking down the barriers, right? There's no, as we talk about the religious aspect and things like that, we're removing those barriers for access to healthcare. Everybody should be treated equally in this community.
You know, he told me, we had this conversation about him becoming board chairman of Holy Cross Health, and he told me a story that I literally got emotional over because it's such a minor thing. I'm making a minor observation in Mpox and HIV and COVID-19 and all of the things that we faced in these last 3-4 years. He told me that being married, a long-time married man, he went into Holy Cross and he was worried about that he could say, "This is my husband." And Holy Cross completely embraced, "Oh, is that your husband?" No issue at all. We're writing it on the board. His husband is, and it was a complete embracement
I love that.
of LGBT. So it's
I
a
love that.
vertical embracement. That's what's great
Right.
on the HRC's recognition
Yes.
of the diversity of one of the best LGBTQ healthcare systems in the nation, and it's sitting right here in Wilton Manors, Oakland
Right?
Park.
Holy Cross is kicking ass.
That's right. Holy Cross is kicking ass. Can we say kicking ass and Holy Cross in the same sentence?
I already did.
Oh, you
Yep.
did it. All right. So, Kim, Vaughn,
Yes.
thank you very
Thank
much,
you.
and
We
happy
love you.
Pride to you. We're happy.
One
you.
more thing I want
Yeah.
to say.
Oh,
Yeah.
yeah, of
And,
course.
you know, we came out with a high performer score. So we know you at Queer News and happening out that supported Holy Cross being on there. We decided to come to bring you your,
No way!
yes,
I
so-
got a jersey?
yes.
You got a jersey.
And nothing,
But now you got to wear
And
it.
by the way, nothing for me, Faye, is truer. High performer. High performer. Right?
Yours should
Thank
say
you.
high performance bottom. That's what mine should say. High performance bottom.
Thank you very
Oh,
much.
I love it. I love it.
All right.
Thanks,
well,
Al.
healthcare is important.
It really
and
is.
We're showing you everything that goes on in our community. Kim, Vaughn, thank you very much.
Thank you so
Thank
much.
you.
You know I'm not
Thank
that butch, right? But I can bedazzle this.
David,
I can
I'm
tie it in the
sorry.
front.
Absolutely.
It's going to have pink on it the next time you see it.